Undesirable results from a past surgery or simply the passing of time can necessitate revision surgery. Our friends from Austin Plastic Surgery Center were in recently to tell us about their detailed process of helping you through it to reach ideal results. Today we begin our conversation with Dr. Sergio Maggi and Tricia Rollman-Vargas of Austin Plastic Surgery Center on the corner of Far West and Mopac. We're talking about revision surgery. Guys, thanks so much for being here today.
Thank you.
So you have a three-part process that you like to adhere to, right?
Well, I think it just makes sense. It's sort of developed over the last 10 years or so that we've been in practice, almost 12 years now. And the focus is really on what is it that leads to a predictable outcome, because that's really what it's about, right? That's where the anxiety is. Am I going to get what I think I'm going to get? Am I going to get what I'm hearing? Well, the consistency is determined by a system. And the system we have is attention to details. But I think the attention to details is really in three phases. And the first phase is the understanding, the prioritizing. What are your goals? What do you want to achieve? What was not done the first time in your prior surgery, or what's changed from that first surgery you might have had 10 years ago, and now you're not happy with that area. For example, breast. Over time, the changes that occur are sometimes profound, and they require a more detailed operation than a simple breast augmentation. And those details are either a breast lift or adjustment of the pocket to make the implant sit in and up, etc. The other type of operation that's also very demanding is nose surgery or rhinoplasty. Not for function, but for appearance, right? Because the functional part is the breathing and all that. Our focus is really on the appearance of the nose, assuming the breathing is good. Not to make the breathing worse, but the attention there is to enhance the shape of the nose, just like the breast, in a way that's harmonious with the patient's body. So it all matches and it's all looking very natural and beautiful, an improvement. But on noses and breasts, it's all about symmetry, and that symmetry is so critical. And that symmetry has to not only be present at the end of the operation, but has to be present after you're healed. And that healing period, the critical part, I think, is the first 3 to 4 months. So in that time, again, it's attention to detail and focusing on proper healing, proper scar formation, and softening of the tissue, no painful areas, and also the shape and appearance that you wanted to obtain, your goal.
It's such a critical part of it, and Tricia, that's where you come in, making sure that that post-op care is on point and followed, right?
100%. I mean, with my own personal experience with other surgeons coming in to work with Dr. Maggi as a student, I was just still actually in school, finishing up, and I came in as an apprentice and was hired on, and the knowledge that I attained during that time period was so different from anything that I'd ever experienced, and that also in turn made me, respect the practice so much, and knowing that I didn't have those experiences. So I know how critical they are, because I know for a fact I would not have had some of the problems that I had, prior to being with him, if I had had the attention to detail and the proper follow-up care. So that's why it is critical that, we see our patients just as much as possible, and that they have constant communication with us to know that they're headed in the right place with their healing and the entire process of it.
I know you're always available to them. Thank you so much for being here.
Thank you.
And go to drmaggi.com to learn more about their procedures, meet the team, and see their private surgery center, or to book a consultation.